Hello again. This week's session is about finding and using public health data in epidemiology. In the first part of this session, we're going to talk a little bit about descriptive epidemiology and how we can describe a public health problem in terms of person, time, and place. The second part of this lecture is dedicated to presentations of the key sources of epidemiological data available in Canada. The goal of descriptive epidemiology is to describe disease or exposures in populations by answering questions about who, what, when, and where. The goal of analytical epidemiology is to find the causes of diseases in populations. That means that it answers questions related with why and how, and it provides useful insight about different aspects of disease. Both approaches are important, but in this session we're going to focus on descriptive epidemiology. Descriptive epidemiology provides a way of organizing and analyzing data on health and disease in order to understand variations in disease frequency geographically and over time, and to understand how disease varies among people based on a host of personal characteristics. Descriptive epidemiology also provides a systematic method for characterizing a health problem. By conducting descriptive epidemiology, we can make sure that there is an understanding of the basic dimensions of a health problem. It also helps to identify populations at a higher risk for a health problem, and it also provides information that can be used for allocation of resources and to enable researchers to develop one or more hypotheses that can be later tested. Person, place, and time are related to the who, when, and where aspects of descriptive epidemiology. Person refers to characteristics of the patients or the population being described. They might be characterized by age, race, sex, education, occupation, or other characteristics. The place aspect might include information on where the home, workplace, or school are located, for example, when an outbreak occurs at one of these settings. Time might be used to describe time of illness onset or to describe when exposure to risk factors occur. The next few slides will walk through each of these aspects in more detail. Personal characteristics might refer to factors such as age, sex, race, but they can also include other characteristics such as marital status or activities or use of medications or living conditions such as socioeconomic status or access to medical care. In general, age and sex are the most used characteristics to describe person data for descriptive epidemiological purposes. Usually, epidemiologists begin the analysis of person data by looking at each variable separately, but sometimes more than one variable can be analyzed at the same time. Person data might be shown in tables or graphs and combine more than one type of person data. For example, this graph shows the percentage of obese Canadians in 2010 by sex and age simultaneously. Person data can also be combined with other types of descriptive data. This graph shows changes in the prevalence of obesity over two different periods of time in the United States. So data from 1988 to 1994 is shown in the light brown bars, and the data for 2007 and 2008 is shown in dark brown bars. In this example, person data is categorized by age. The table shows the reported rate of abortions, which is the number of abortions of women in a given age group per 1,000 women in the same age group. The data is displayed by age group and year from 2005 to 2007. Epidemiologists and decision makers can use this type of data to plan for social interventions and family services. Age data is usually presented in intervals, with the cutoffs for the intervals changing depending on the type of disease or event that is under evaluation. Descriptive information about place provides insight into the geographical extent and variation of the problem under study. Place refers not only to residency area, but it refers to any geographic location. It might include place of birth, site of employment, school district, hospital unit, or even recent travel destinations. The unit of analysis might be as large as a continent or a country, or as small as a street address, a hospital wing, or an operating room. Analyzing data by place can help to identify communities at increased risk of disease. Place data can be shown in tables. For example, in this table, we can see an analysis about the emotional anxiety level of children by rural versus urban place of residency between 2006 and 2007. Place does not always have to be a geographic designation. It can be any kind of location. During the SARS outbreak in 2003, people riding the same plane as potential SARS case patients were characterized by place when it was established how close passengers were seated to the SARS case patients. In this map of airplane seating, a confirmed case of SARS is shown with a plus sign. Probable cases are shown in the purple boxes, and probable cases among crew members are shown in the oval starburst in the aisle. This is a table showing place data on obesity in Canada in 2004 by sex. In this case, the place under examination is at the provincial level. We have seen that place data can be shown in a table or a graph. However, a map provides a more striking visual display of place data. For example, different numbers or rates of a condition such as obesity can be depicted in a visual map using different shadings, colors, or line patterns. There are two main types of maps: choropleth maps and spot maps. Choropleth maps use different shadings or colors to indicate the number of cases in an area. A more intense color or a darker shade usually corresponds to a higher number of cases in an area. A spot map, on the other hand, shows the location where individual cases occur. This is a choropleth map about obesity in Canada. Red areas had the highest percentage of adults categorized as obese compared to the national average. The areas colored in green had lower percentages of obese population. It is much easier to grasp information from a map such as this one. However, the detailed information that sometimes is presented in a table cannot all be shown in a map. This is a spot map, also called a dot density map. This is in fact one of the most important maps ever made. This is the map that John Snow used to illustrate how cases of cholera were centered around the pump at Broad Street in Soho, London. Spatial epidemiology was born as the spot map brought to light new information from the spatial pattern of data about cholera epidemic in London. Disease rates and risks can also change over time, so time is another element of descriptive epidemiology. Time data is usually shown on a graph. The number of cases is usually displayed on the vertical axis, and the time periods of intervals are shown on the horizontal axis. The time interval on the x or horizontal axis can change from hours or days to years or decades. The time period depends on what disease or event is being described. Graphs by times are used to show trends in events, seasonality of diseases, day of week or time of disease occurrences, or they are also useful to show the period over which an epidemic takes place. Time data is usually presented with line graphs or histograms. Time is plotted in the horizontal axis, and depending on the disease, the time scale might be years of decades, or it can be as short as days or even hours of the day. For some conditions, such as chronic diseases, epidemiologists are more interested in long-term trends or patterns in the number of cases. For other conditions, such as outbreaks, the relevant time scale is likely to be days or hours. Some events can be displayed in descriptive epidemiology using time data, for example, secular changes, point epidemics, cyclic trends, and seasonal variations of a condition. Secular changes, for example, refer to changes over a long period of time, generally years or decades. They occur slowly over long periods of time, and they are usually displayed longer than 1 year. Point epidemics refer to short-term changes that occur over limited time frames, such as hours, days, weeks, or months. Point epidemics are used for short-term exposures or diseases with short incubation and illness duration. Cyclic trends might refer to long-term or short-term events. Some of them are seasonal, while others are cyclic due to a variety of factors. Seasonal variations can be observed for some diseases or conditions falling within a calendar year. Time clustering data can sometimes be used to trace the beginning of a condition. For example, the incidence of toxic shock syndrome caused by Staphylococcus aureus infection in women increased when women started to use newly hyperabsorbent tampons in the 80s.